Hello. Welcome to normal aging in agricultural populations. It's been a long day today. I had planned for you to have multiple videos attached to this lesson, but that was not possible because the file size was about 8.5 gigs. And so I had to start from scratch, so apologize for the delay, but I want us to get started on what it's like to age as a farmer. So we're going to talk about those common aging symptoms that occur, and our resource for this is Eliopolis's Gerontological Nursing. Now, I know that not everyone that takes this course is a healthcare provider, either nursing medicine or another discipline. So I will try to be as generic as possible so that everyone can understand specifically what we're trying to get across as a basic level of gerontological care in farming populations. Okay, so agricultural occupations actually mirror the dynamic change and transitions of life on a continuous basis. Every season is different. Every crop is different. We rotate crops from farmer to farmer. They no two have the same equipment or the same land that they take care of or the same types of animals or crops. So it's constantly changing as the environment changes, both the natural environment and the economic environment. North Carolina agricultural occupations are among the most diverse in the nation because of our land mass and geography and topology, and thus is highly individualized and impacts the aging in just as diverse a manner because their exposures are so very different. Those differences in exposures differ in the body systems and their impacts on adults as they age over time. And we all know that aging response is genetics, which we cannot change, but that environment, diet, our health status, the stressors that we have, and our lifestyle choices make a huge difference in our health status outcomes and in how we age. So the very basics of aging start at the cellular function. Cells decrease, and this leaves a decreased number of functional cells. Hence, your immune system at an older age is going to be reduced. Your lean body mass decreases, and your total body fat increases. This means that the strength and the stamina of that farmer, be it male or female, is going to be reduced. Your extracellular fluid remains constant, but that intracellular fluid is reduced, and that equals less total body fluid, which means there's going to be some level of cellular dehydration, and that affects the function of every organ system in the body, and it also affects the needs that you have in processing any medications that you may have to take as an older farmer or agricultural worker. So let's look at the changes in the respiratory system specifically. You've already had education from our staff about the respiratory risk and dangers. Well, take into account that our older farmers, which average 58 and older, have a reduction in respiratory activity. There's calcification of the costal cartilage. The trachea, rib cage become more rigid. That means that motion is less flexible, more tight, and they cannot clear those exposures, be it air, the particles, the dust, the bacteria. They have a reduction of cough and laryngeal reflexes. They can't cough it up. So that puts them more at risk. They're going to have increased residual capacity and reduced vital capacity. In other words, they're going to be retaining more of that CO2 and breathing off less of it. And all these things put them, a normal aging person, at high risk for respiratory infection. So couple on top of that all the exposures that a farmer will have to soybean fibers, cotton dust, corn dust, working with turkeys and chickens, the manure that gets attached to the air particles and the feathers. So all of this increases greatly their opportunities for respiratory infection. I want to pull you back to something that you heard in week 1, part 1, about the family being the farmer. So as the farmer ages in place in his home environment, that wife, if she is working on the farm, is assisting. Perhaps the children are assisting until they age out, or if they come into the family farm, they are helping. But a longitudinal exposure, so if these 58-year-olds started farming when they were 15, their longitudinal exposure is great. And now, earlier on, it may not have bothered them so much, but now it really makes a difference. And perhaps that wife is now retired from a public job and working, and she also has exposure. So I want you to take that into consideration, the dynamic of the culture and its impact on these exposures. So let's do a question. Which of the normal age-related changes of the respiratory system can increase the risk of infection in the older adult population? Is it decrease the anterior-posterior diameter of the chest? Is it increased strength of the thoracic musculature? Is it increased residual volume and reduction in vital capacity? Or is it decreased calcification of the costal cartilage? Think about it. Okay, so it's increased residual volume and reduced vital capacity. So as that residual volume increases, the vital capacity is reduced and maximum breathing capacity decreases as we age, placing older adults at a high risk for developing respiratory infections. This is not a disease. This is a normal process of aging that puts this population at a higher risk. Okay, so let's look at the changes in the cardiovascular system. The heart dimensions are actually unchanged in the absence of a pathology. We'll talk more about pathological changes during our second part of Gero. The heart muscle does lose efficiency and contract strength. Thus, we have reduced cardiac output with physiological stress. So the harder they work, and remember, we've already talked about the cellular changes. We're going to talk about other physiological changes that support the fact that they will experience physiological stressors, and therefore they're going to have reduced cardiac output. The valves become thick and rigid even in the absence of disease, making it harder to pump, slowing down the internal core temperature. Blood vessels reduce their elasticity, their efficiency in pumping, and the oxygen is used less efficiently. So just think about some of the things that a farmer will do. Again, the strain on the heart as you're working continuously in the field, lifting, pulling, climbing, walking. That continuous strain longitudinally will, in the absence of disease, these changes are going to make it more difficult for them to do their work, and they will adapt. You will find that these older farmers will adapt. Let's talk about the changes in the gastro system. Tooth loss is actually not a normal part of aging, so they should be retaining their teeth. However, you may find that the dentin is reduced over time and giving more exposure to bacteria entering into the dental system. However, there is less acute taste sensations, and that may be one reason that these farmers will have an increased request for salt. But also remember, if they have less cellular hydration on a normal basis, and they're working consistently in the environment, heat, cold, their need for water is going to be greater, and they may actually be depleting a lot of salt through sweat, which will increase that desire for salty things. Thus, you'll have a lot of them that'll tote salted peanuts or salted pork rinds in their truck. Decrease esophageal motility. They get things hung as they try to eat. They have atrophy of the small and large intestines on a normal basis. This is not abnormal. This is a normal change. So their bowel functions will change, and this will be very difficult for them to discuss at times because of, again, their culture with being comfortable with talking about these types of issues. They have an increased risk of aspiration, indigestion, and constipation, and you will actually see them drink something fizzy and choke and cough. You will see them carry a bottle of Tums in their truck all the time, or Pepsi. They will have across the counter something, and they will consistently complain of indigestion. And you will not hear them talk too much about their bowels, so it's really important to ask about bowel habits. And remember, these are normal changes. So, another question. The atrophy of the small and large intestine, with fewer cells present on the absorbing surface of the intestinal wall, causes certain vitamins and minerals to have a decreased rate of absorption. True or false? And that answer, of course, is true. The absorption of B12, vitamin D, calcium, and iron is decreased in the intestine of the older adult. So it becomes very vital for us to assess these normal changes in the agricultural worker population who are aging. What are they eating? If their wife is working a public job and has not returned to the home, then breakfast may be at the local diner or the local store. The lunch will be, again, local diner, local store, and if the wife is cooking a meal, it'll be supper, and it may be a large one. So the content of what they're eating is important to assess. Are they getting their B vitamins? Do they need a supplement? Do they understand what they're needing, and can they assess how to increase these vitamins, calcium, and iron in their diet? Okay, so let's look at their urinary tract. There's a decline of the renal blood flow and the glomerular filtration by approximately 50% by the age of 90. And although our mean age of the farmers is around 58 or maybe slightly older now, we still have farmers in their 80s who are actively engaged in working on the farm, and therefore we need to be attuned to assessing properly these normal changes. They have reduced bladder capacity, so their urgency may increase. They may have nocturia, and this is common in older adults. Important to note that a normal change, and I'm sure most of our healthcare providers can attest, that the males will have prostate enlargement and the females will have estrogen depletion. And while they may have estrogen depletion, if either the male or the female have large fat reserves, if they are obese, there will be estrogen in their system that is adding to the imbalance of the aging process and putting them at risk for cancer and other disease states. So let's look at the changes in the musculoskeletal system. Normal changes of aging agriculture workers, they're going to be thinning disc and shortened vertebrae that cause decreased heights. We've already talked about reduced muscle mass, which is affecting their strength and mobility, decreased bone mineral and mass, diminished calcium absorption, and increased risk of fractures. And a lot of times our men will think, oh, that's a woman. A woman has osteoporosis. Men can have the same and similar changes relative to the bones. And it is important for them to understand how their diet on the farm influences that. So the more sodas they drink, the imbalance between the phosphoric acid and the calcium, and the pulling across and depletion. In addition, the work that they do with their hands, the constant vibration on the tractors and on the truck, causes inflammation of these vertebrae, which leads to greater issues, and we'll get more into that in our chronic disease. But just know that the normal is they're going to have less strength, less bone density, and that the work itself produces an environment that further agitates these transitions. Okay, so let's look at the nervous system. They will have a decline in the weight and reduction of the blood flow of the brain, not affecting thinking and behavior. So remember, we talked about there being less intracellular hydration, water. So anytime you have cells that are drier, they're going to weigh less. But this transition in the cells reduces the neurons, nerve fibers, and cerebral blood flow. And it's slower response to change in balance. And we'll look at a farmer in some of the videos that we're going to post, and you'll hear them talk about how they have not failed, but they do have an altered balance. And you'll listen to them describe that to you. The hypothalamus is less effective in temperature regulation, so heat and cold, they can't withstand the cold as they used to. They can't withstand the heat, and they are so attuned to being out in the environment that they may not be as aware of these heightened temperatures and the need to prepare for them. They also experience changes in sleep patterns with frequent awaking during sleep. In our videos, you'll hear our farmer talk about exactly what this is like for him. So, which of the following is a normal age-related change of the nervous system? Is it decline in the weight of the of the brain? Is it increase in cerebral blood flow? Stage 1 and 2 sleep are interrupted, or there is higher nerve conduction velocity. Think about that a minute. Think about what we said is normal. It's the weight. Dehydration. Keep on thinking the older adult has less intercellular fluid, and because of that, it affects every system, and this is one where it really does. The sleep does become less prominent. The nerve conduction, remember, is going to be slower, affecting their response and their balance. So think about a farmer being on a tractor or trying to jump off of a tractor, and what the delay in response can mean to safety and health. It increases the risk that they are exposed to. So let's look at the changes in the sensory organs. With advanced stage, we have changes in vision, hearing, taste, smell, and touch. Think again, less intracellular water. They have decreased efficiency of the senses, can affect. Okay, think for a minute. Anhydrous ammonia has a peculiar smell. And that smell is specifically there to help you know that a noxious agent is being exposed. If you cannot smell that agent, then you are more likely to remain exposed. And that can happen if you can't smell or touch. Similarly, if your vision through normal aging changes is diminished, then when you're operating equipment, it becomes imperative that you transition and have safety plans in effect to make up for these transitions in aging. So, changes that you may have are presbyopia, the inability to focus on close objects clearly, cannot read the label on the MSDS, narrowing of the vision field, decreased peripheral vision. When you are running a closed cab truck and tractor, and you've got either a sprayer or a plow that spans 25 feet, peripheral vision is extremely important so that you're not hitting other objects. It's bad enough when you're on the field. It becomes more imperative when you're moving that equipment down a busy highway. Your pupil size is reduced and less reactive to light. Your depth perception is distorted, and your visual acuity declines. My 60-year-old farmer still has not gotten prescription glasses. He prefers to go to the dime store and get his 2.25 lenses there. Okay, so presbycusis, progressive loss of hearing. We'll talk more about a hearing loss issue with the farmers and their exposures. You'll get specifics about decibels, and I believe Jessica Wilburn will be giving you that. But there's also a distortion of high-pitched sounds. Cerumen increases in the ear canal, affecting hearing, and while most of them bathe on a frequent basis, you will probably find that not many of them are routinely checking the cerumen in their ears. So as the healthcare provider, that's something you can check when they come in. There's also an alteration in their equilibrium, again affecting their balance. There's a sense of smell that is altered with age that becomes a safety issue, a taste acuity, atrophy of the tongue, which can diminish taste, decreased saliva, poor oral hygiene, and medications may make them have a metallic taste in their mouth. But all these sensory issues, again, are normal changes that they will experience as they move into their 60s, 70s, and 80s. The tactile sensation, the pressure, their ability to feel at the end of their fingers is really important because they're all the time screwing or sawing or welding, and these sensations are extremely important to their safety because every farmer, no matter whether he's a crop or animal or fruit farmer, has so many vast skills in North Carolina that the reduced ability to sense pressure, discomfort, and the deviations in temperature are really going to put them at high risk let's talk about the endocrine system. The thyroid gland activity decreases, so their T3, T4, TSH may be altered. Their ACTH secretion decreases with age. Pituitary gland decreases. Insulin delayed and insufficient, and this again is not abnormal, it is normal. Therefore, they may experience normal metabolic glucose reduction. Therefore, you may have these farmers who read with higher blood glucose that are not diabetic. So be careful when you're screening. If you're getting a reading that's a little high, that you immediately diagnose. Remember, it's more than one reading. It may take additional testing to come up with a firm diagnosis. So I think that's one of the issues with health screenings. If we're not tracking them back to their primary providers. For the integumentary system, their skin is less elastic, it's more dry and fragile, decreased subcutaneous fat. Therefore, their skin will tear and they readily bleed. They will have a lot of open wounds, a lot of bruises because of the very things we just spoke about. If they can't feel the agent next to them, which may be a loose screw, a loose bolt, a piece of wire, they rip their whole arm, the outer epidermis, and they're bleeding profusely. They just throw a cloth, a handkerchief over it and keep on going. They have thinning, graying of the hair, may have loss of hair, alopecia. They have reduced sweat gland activity, and well, reduced sweat gland activity. Remember, thermoregulation is altered. They can't tell when they're too hot. So if they have a reduced sweat gland activity and they can't tell when they're too hot, heat stroke may occur more readily than it did at a younger age. They have T-cell activity declines, cell-mediated immunity declines. Their risk for infection becomes significant. We've already talked about respiratory, just talked about skin. All opportunities when you're in a hog house with manure, turkey house, chicken house, and you're with all that E. coli and all that bacteria, that risk for infection through the skin or through the respiratory is going to be much greater. The inflammatory defense declines and it presents atypically. Normal body temperatures in the older are lower, and so if they come to you and you say, have you had a temp? And their temp may have been 99.1 for 4 days. Be alert, because if you don't have a good baseline, that 99.1 may be an indicator of an existing infection because their mean body temperature is lower. So if they present, make sure you're getting a good temp on them. We've already talked about their ability to respond to thermoregulations, so I won't go over that again. They will have physiological changes that are influenced by, or psychological changes, influenced by health status, genetic factors, educational achievements, activities, social changes, physical changes. But I want you to think about, as they are aging, they have worked all their life to attain and maintain the farm. And when that farm, that way of life is threatened, then their psychological stressors are increased greatly. And their ability to cope as they age becomes less. And so, as Robin has probably discussed with you, her dissertation about those who considered suicide, we have reports of those who attempted suicide. I can tell you that we have friends who have farmed since they were 15 years old. They went to NC State, graduated, came home. They're 72 now and stand to lose everything they've worked for all their lives, to the point that their children cannot afford to get into the business with them, and they can't afford to get out. The stress is great. Their coping mechanisms are less, and faith is a big thing for them, and I'm sure Robin and Mike Rossman talked to you about that. But some don't have that coping mechanism, and they will turn to alcohol. So it's important to learn how to assess through the expert, and I will talk more about that when we talk about disease in the elderly. The personality should remain consistent in the absence of disease. So if you see huge personality changes, then you need to suspect that something is wrong and they need assessment. Some family members will make excuses and say, oh, he's just getting older, he's just ornery, and they fail to follow the issues that are going on. That happened with my father-in-law, and until he actually ran over somebody and almost killed him, they did not accept that this individual had Alzheimer's. They made every excuse in the book for the personality changes, except dementia. So when there are changes in their personality, be alerted. They may also experience changes when they're forced to retire. If their spouse dies and they're left alone, especially if it is a man who has depended greatly on a woman, or a woman that has depended greatly on the farm for the man, they may experience a loss of independence as they age. If they can't jump on that tractor as fast, and they cannot think as quickly, it frustrates them. They feel like they're losing control because of the independent nature of the culture. That independence is really important to agricultural workforce. If they have that reduced income, or they're experiencing some form of disability, you may see an alteration in personality. And there are no personality type labels for older adults. We have short, long-term memory, sensory, and age-related forgetfulness. However, learning ability usually does not change in normal aging. Learning is best when new information relates to previous information. And sometimes it's difficult for them to break bad habits for better habits. So incremental changes in health status behaviors, health promotion behaviors is much better than a large plan. Rather than trying to change everything at one time, say, let's drink 2 waters a day. Let's replace 2 Mountain Dews with 2 waters. Sustain that for a period of time and then make one more change. Small changes matter. When it comes to gerontological nursing, understanding aging is important, and it certainly is no less important when it comes to the agricultural workforce. Again, it is because their work is their life. It is their home. They live it day and night. It's not like an 8 to 5, 5 days a week that you retire from. They don't retire. Here are our references. This PowerPoint, the content was provided by Eliopoulos, Gerontological Nursing, Chapter 5. And then I want to draw your attention to Monahan, Lauer, and Rolf's fatal incidents in Australia's older farmers. Sorensen, Tink, Will, and Droulard, Symbolic Interactionism, a framework for understanding risk-taking behaviors in farm communities, and Nielsen's Interventions to Reduce Injuries Among Older Workers in Agriculture. These are readings that you may benefit from if you have the time. If not, I hope this lecture has been helpful. Rather than a lot of reading, this will require that we look at some evaluations we did of an older farmer. And as you look at these assessments that were done, if you can pick out those things that are normal changes from his responses, and not only pick out the normal changes, but identify those that indicate a health and safety risk and a concern. Thank you for your time today, and I hope that you have learned something. I know many of you health providers probably have a baseline data, but I hope this was a good review for you. Take your knowledge and overlay it in the occupation and the culture of the people and make it real, so that when they come into your clinic, you can respond to them with caring.